Welcome to this second evening webinar about kidney disease and the role of diet with Dr. Cecilia Villaverde, hosted by us at DECRA and Specific. And tonight we will focus on dogs with kidney disease, and the title of the lecture is Canine Chronic Kidney Disease, Role of Diet in the gut-kidney axis. And tonight we have, as last time, almost 1,000 registered to this webinar. So I think that's a big interest in the topic. And I'm Linnea Berglund, and I work as a product manager for Specific in the Nordics, and also partly in the central nutrition team in DECRA. The reason behind arranging these two webinars focusing on diet in the management of kidney disease in dogs and cats, it's of course to share the latest research in this area, but also because Specific just or soon, depending on country, will launch a range of brand new hydrolyzed kidney support diets, and also an updated version of the existing kidney support diets. The new diets, they are, as I said, hydrolyzed, and they will have all basic characteristics of our existing renal diets with reduced phosphorus, protein, and sodium levels, and high levels of omega-3 fatty acids, EPA and DHA. But they also contain highly digestible and hydrolyzed salmon protein, together with potato, and also added gut-supporting ingredients and zeolite. And this will give efficient support to the gut-kidney axis. They will support a healthy gut and also a balanced microbiome. And this will support the vitality and also hopefully prolong the disease progression even better in patients with chronic kidney disease. Some countries where we sell Specific have already launched the new diets, and some will do it in the near future. And please contact your DECRA representative if you have questions about the diets or when they will be launched in your country. There will be time for questions after Cecilia's presentation, so please write your questions in the chat box in the panel. And we do also record the lecture and we'll send out the link to it as soon as it is uploaded on DECRA Academy. So if you need to go away, or if you want to watch again, or if you have a colleague that want to watch, then you can tell them that they can do so by finding it on DECRA Academy. And now I will leave the word to you, Cecilia.
Okay, so hopefully you can all hear me. Okay, so good evening. And I would like to thank Specific DECRA for inviting me to speak today, particularly to Linnea. I'm very happy to be talking about chronic kidney disease tonight in dogs. If you attended or have watched the feline one, there will be definitely overlap, but I did try to make them different enough to talk about different things as well. Before I start, here are my conflicts of interest. I am an independent nutritionist. Most of my work consists in helping veterinarians with their complex nutritional cases, but I do consulting and paid work for a variety of pet food companies. And I have been a speaker or attendee in meetings sponsored by pet food companies as well. And I am a member of the Scientific Advisory Board of FIDIAF, which is the Pet Food Industry Association in Europe. However, I don't get any payment for that. None of this is going to be affecting the content of the talk today, but you need to know what my business is. All right. So let's start with a bit of an introduction. Chronic kidney disease in dogs. I think sometimes we care more about in cats because it's definitely more prevalent in cats, but we do see it in dogs often enough, especially in the senior population. And this is a disease that's chronic and progressive and has multiple etiologies. In many cases, we will never know what the cause is, but sometimes you will. For example, I have trained in Spain because I am from Barcelona, and a lot of the times my CKD canine patients are dogs with leishmaniasis because it's an endemic disease in the south of Europe, including Spain. But now that I live and work in Ireland, I think I've only seen 2 leishmaniasis cases, and they were all dogs that were from Spain and emigrated here. So whatever the etiology, whatever the cause, the disease progresses similarly. Basically, when we're losing the nephrons, the disease is going to progress, the clinical signs are going to appear, and we manage them similarly, at least symptomatically. And the treatment is mainly focused on controlling the clinical signs. Like if we know the etiology and that etiology has a treatment, of course, that needs to be done. But overall, you will need to control the clinical signs and manage any metabolic derangements that you will see, such as acid-base imbalances or electrolyte abnormalities. We have mainly two treatment options that have been shown to prolong survival. One of them is dietary management. Just to show you, this is a study that's already more than 2 decades old by Jacob and collaborators. They gave dogs with CKD, spontaneous disease, either a maintenance diet or a kidney diet, and they saw a longer survival and also a lower incidence of uremic crisis. The other treatment that has been shown to prolong survival in dogs is the use of ACE inhibition treatment, particularly in dogs with proteinuria or protein-losing nephropathy. We definitely need more therapeutic target, especially because we're diagnosing this disease earlier and earlier, and we need definitely more evidence that even diet and medications will be as effective when we use them earlier in the disease. And one of the newer areas of research that is being more studied currently is the gut-kidney axis, and this comes a lot from the human side, where chronic kidney disease is also prevalent, and a lot of our human patients are dialysis dependent. And there's definitely focus on how the gut is affected by the kidney disease and vice versa. So this is from a paper by Dr. Summers and Quimby. They have been the ones that have been leading the charge in this research. And just to show you one of the things that happens in kidney disease regarding the gut, or some of the things. So this is this review, and here is the title so you can read it at your own pace. This review focuses on the gut-kidney axis, right? And one of the things it focuses on is on uremic toxins that are generated in the gut, or gut-derived uremic toxins. Probably the most well-known are indoxyl sulfate and p-cresol sulfate, but you can also have TMAO and others. As you see in this chart, a lot of these gut-derived uremic toxins are derived from amino acids like tryptophan, phenylalanine, and tyrosine. These 3 amino acids are what we call aromatic amino acids. And when they are metabolized by the bacteria in the large intestine, they can give rise to some of these gut-derived uremic toxins. Some of them are further metabolized in the liver, and then they go into the circulation. So this is generated normally in the gut. What happens when there is kidney disease? What happens first? One of the things that we suspect happens is that there's some protein malassimilation. So there's the dog or the cat will have more trouble digesting and absorbing this protein, so more protein will reach the colon or the large intestine, where it can be fermented into these uremic toxins or uremic toxic precursors. Proteins can also be fermented into other molecules like branched-chain fatty acids, like isovaleric acid, or other metabolites like putrescine and cadaverine, and these metabolites can have negative effects on gut health and structure. The other thing that will happen in kidney disease is the kidney disease will promote dysbiosis, or an unbalance of the microbiota, mostly the bacteria, but also other organisms that live in the gut. And it seems that the way that the kidney affects this microbiota is shifting to more of a fermenting carbohydrates to fermenting the protein. So again, you will have an increase in the generation of these toxins, and this can be made worse by constipation. As you know, dogs with kidney disease can have a higher prevalence of constipation, maybe due to subclinical dehydration or electrolyte abnormalities. And when there is constipation, the material stays for longer in the colon, giving more time to the bacteria to ferment this protein. Okay. Finally, uremia, kidney disease, can also affect the barrier function of the gut. So there's, sometimes we call this leaky gut, but there is a failure of barrier. So these toxins are easier, go easy into circulation just because of this decrease in the barrier function, which would protect a healthy animal. Finally, then these gut-derived uremic toxins will reach the circulation and should be excreted by the kidney. However, when we have kidney disease, we have a decreased glomerular filtration rate, so there's a decreased excretion. So all of this to say, when we have kidney disease, there's an increase in the synthesis of these toxins and a decrease of their excretion. So the net result is that they build up in the body, right? And then they can contribute to uremia and uremic signs, including in the kidney, where they can potentially contribute to progression. So that's the thinking. There's mostly data from humans and rodent models, some in cats, some in dogs. But this is a very active area of research, but this is what we think is happening. Okay, so what can we do diet-wise? And we're gonna talk a little bit about that. I'm gonna talk about how diet is used to manage CKD classically, and then how with diet, how can we help a little bit with this gut kidney axis situation, and what's the evidence? And a bit of a spoiler alert, there's still a lot that we don't know. Okay, so but there's some things that we can already do that can potentially help. So diet therapy on chronic kidney disease is the main treatment, and as I already told you, is basically the main thing that will slow down progression, that we have good evidence that can give us more time with our dogs with kidney disease. And our goals of nutritional management, first of all, would be to provide energy and nutrients. As always, this is why we eat, in a way that we can help control the clinical signs associated with uremic toxins, manage metabolic disturbances, mostly electrolyte, but also acid-base imbalances, and finally slow down progression, which we have good evidence that we can do. That said, like a lot of those papers, as I said, pretty old by this time, like a couple decades old. So it would be really nice to have more long-term outcome research on newer dietary strategies and other treatments. So the characteristics of kidney diets are a bit summarized in this slide here. They're very, if you were listening to my feline webinar, they are basically the same. You will see that the degree is different, but the idea is the same. Phosphorus restriction, protein moderation, moderation of the sodium, enrichment with omega-3s, B vitamins, potentially potassium, and others, right? That said, right, we do have some minimums that need to be met, or some characteristics that need to be met to be a kidney diet, but there are differences between different commercial products. So not only in where my phosphorus is or where my sodium is, but also in the ingredients, palatability, energy density, availability, cost, etc. This is really nice because it allows you to customize the choice. Of course, depending on your geographical location, you will have more or fewer choices. But I am definitely lucky that I have, like, as I would say, almost 20 different choices for managing CKD in dogs. So phosphorus, I'm gonna be briefer here than I was with the cats, but the idea of restricting phosphorus would be the same as in that species. We know that in chronic kidney disease, one of the things that starts failing is the capacity of the kidney to excrete phosphorus, and this results in accumulation of phosphorus in blood. And this triggers a cascade of hormonal changes that can further make the disease progress. So it can activate the parathyroid hormone, which is considered a uremic toxin, that can have effects on the bone, in the gut, and the kidney itself. And this can end up promoting mineralization of the kidney, further damaging the kidney, further accelerating progression. So phosphorus restriction, or trying to manage that blood phosphorus, is a priority in CKD patients. And the International Renal Interest Society does give you some recommendations on target blood phosphorus, depending on the stage. You want to keep it within those ranges. When you're getting into later stages like 3 and 4, it's harder to keep it on range. And the recommendation is the first use diet, a phosphorus restricted diet, as is the one that we have the most evidence that it works and can help. We do know that given a phosphorus restricted diet will help control blood phosphorus, and it will also decrease parathyroid hormone concentration in these patients. If diet isn't enough, then you can also use binders or phosphate binders. So there's different binders, like it's not in the purview of this talk to discuss them, and they all have their pros and cons. But since we're talking about the gut-kidney axis, there's also discussion on how the use of these binders can affect the microbiota or other parameters of intestinal health. So if anybody needs a good research project, I think that would be a great idea. So what are the phosphorus values of kidney diets? This is just examples of some of the diets that I have available to me and that I often use. And this will be the phosphorus content in grams per 1,000 calories. I like to express my nutrients on a calorie basis, so I can compare different diets independently of their moisture content or their energy density. Some companies will give this information to you per 100 calories, some per 1,000 calories, and some per 1,000 kilojoules. There's some math that you can do to convert, but as long as they're the same units, you can compare. So you can see that it's pretty variable, right? So we have some that are as low as 0.4 grams per 1,000 calories, and some of them are about 1.2, 1.4. These are the less frequent ones, right? We do have now early stage kidney diets in dogs. They can be a bit higher in phosphorus, but you do have a bit of a range. Most of them are below the NRC recommendations, which is our scientific Bible. So it is a true phosphorus restriction. And almost all of them are below FDF, which is the recommendation for the industry for a healthy dog in Europe, right? So compared to cats, this is definitely more restricted. In cats, the phosphorus values are not necessarily below NRC. And part of the reason is because protein and phosphorus usually go together in the same ingredients. So we cannot really drop the protein that much in cats, so our phosphorus tends to be a bit higher. So in dogs, you can be a bit more aggressive. And the nice thing about having this range is that if I have a dog that I put on a kidney diet, but I still have issues getting the phosphorus within those recommended ranges, then I can check. You know, maybe I'm giving him a diet with 1 gram of phosphorus per megacalorie, and then I can change him to 0.8, 0.7, 0.6. That could help before I have to reach for a phosphate binder. So just because your diet says the kidney diet, don't assume that they're all equally restricted in phosphorus, okay? So this can help you out. And of course, when you have a stage 1, 2, you won't need to be as aggressive as when you have a stage 3 or 4. Let's talk about protein. Compared to cats, this is less controversial, but we do want the same. We want to provide the protein that the dog and the cat needs, just without a lot of extra, right? And moderating the protein helps reduce nitrogen waste products, and a lot of them are uremic toxins, right? So this is very important for quality of life, okay? So the idea is that you would drop the protein, giving them basically enough for body functions and keeping a good muscle mass, but not a lot extra, because when we have a lot of extra protein, we need to get rid of that nitrogen. And when the kidney is not working, that gets complicated, right? And overall, we do tend to look at protein moderation as a quality of life issue. However, it can also have an effect on progression, particularly in protein-losing nephropathies or proteinuric dogs. The idea here is that dropping the protein, even though it sounds counterintuitive, can help decrease the losses through the glomerulus and then reduce the amount of protein in the tubules. So protein in the tubules is toxic to the tubules, and in dogs with protein-losing nephropathy, that protein that's being lost into the tubules is going to be damaging the kidney, and that will progress to azotemic disease, right? So if we can decrease that loss, that can potentially help. And we do have evidence that using angiotensin inhibition medications, or like inhibiting that axis, can slow down progression. And we know that using a kidney diet can also reduce the magnitude of protein in the urine. So there's, for example, this one paper about 10 years ago where they gave dogs for a month a kidney diet, and after that they gave them enalapril or benazepril. I'm gonna ignore that second part. During the month that they were fed the kidney diet, they saw on these dogs that their creatinine and BUN decreased, which was desirable. And all of these dogs that were also proteinuric, their UPC, urine protein to creatinine ratio, also decreased, right? There is a step that we are lacking. Like, we know that moderating the protein diet can help decrease the UPC. We would need to know if that helps progression. It's something we hope, but it's not something we 100% know. But when I do have a patient with proteinuria that's a dog, I will put them on a moderate protein diet. I try to look what they're eating right now and then give them half of that if I can. Or depends on the protein diet that they're eating, how aggressive I need to be. So it can help in quality of life, as I said, and potentially also in progression in proteinuric patients. That's for the amount of protein. The quality of the protein is equally important, right? And quality of the protein is very well defined by the amino acid profile and the digestibility and availability of that protein, right? The more you have to moderate the protein, the closer you are to that minimum to avoid those nitrogen waste products, the more important quality becomes, right? If my protein is not very good quality, but I'm giving plenty of it, I'm going to be finding all my amino acids. But when the protein amount is limited, it has to be really good. It has to have great digestibility and a good amino acid profile, so we can meet our nitrogen and essential amino acid requirements while avoiding the negative effects of uremia. Another potential benefit that we have with good quality protein, together with dropping the protein in the diet, would be that overall there will be less protein in the large bowel, right? If I already dropped the protein that they're going to eat, and that protein is very highly digestible, there's going to be very little protein that's going to be available to be fermented by those bacteria in the gut. So theoretically, the production of uremic toxins from the gut will also be decreased. Talking about protein quality and quantity, there's a lot of things that we don't know about amino acid metabolism in kidney disease. We have some papers that suggest that the metabolism of amino acids is altered in patients with chronic kidney disease, especially in those with protein-losing nephropathy, because they are losing protein through the kidney. And this can potentially be playing a role in weight loss and muscle wasting that we see in some of our patients. This has been well described in people with chronic kidney disease, especially people that undergo dialysis, because they can lose amino acid through the dialysis process as well. So in patients that already have this derangement in amino acid metabolism, what's the contribution of using a moderate protein diet, right? As I said, you're walking a fine line. You want to provide all the amino acids that they need, but you don't want to increase uremic toxins. It just makes it harder, right? So there has been some interest in deciding if it's worth it, while keeping the protein overall pretty similar, if it's worth supplementing maybe essential amino acids as a supplement. Try to keep the overall protein intake moderate, but maybe giving more of those essential amino acids that are important. We don't really know much. There is one paper where they looked at short-term effects of supplementation with an amino acid supplement. This was a retrospective study where they recruited, collected dogs with IRIS 2, 3, or 4. They all had proteinuria, and they had to be fed a kidney diet and enalapril as part of their treatment. And then they separated them into those that had received an amino acid supplement or not orally. So they monitored them, I think, for a month and 2 months total. And what they found is they found some benefits of supplementation. They did see an increase in body weight and the concentration of serum albumin in supplemented dogs, which is extremely positive. But they also saw some downsides. They saw that the patients that were not supplemented had an improvement or a decrease in their urea blood values. And they also saw a decrease in the UPC, a decrease in the severity of the proteinuria, and they did not see that decrease in proteinuria in supplemented dogs. So at this point, I'm not recommending supplementation with amino acids because I don't really know. It's hard to decide if the benefits are higher than the risk or vice versa, because we would need more long-term outcome data, ideally, before we can make this recommendation. And probably this could be different depending on the base diet that you're using. As I will show you now the protein levels of kidney diets for dogs, but they are also quite variable. And supplementation with amino acids could have a different effect depending on which one you're using. But hopefully we will get more research in the future to see if this could be an interesting therapeutic approach. Right. So here are the kidney diets that I have available to me. In blue would be the protein, in orange the fat, and in gray the carbohydrate. And this is percentage calories. How many calories come from protein, fat, and carbohydrate? Again, this allows me to compare the products independently of their physical form or energy density. So one thing you can already see is that the orange is pretty big. So a lot of the kidney diets are very high fat. And this is usually good news because since we're moderating the protein, you want to increase palatability using the fat. And also fat provides a lot of calories. So some of those dogs that have kidney disease can have poor appetites. So giving them something that's yummy and calorie dense can help keep the weight up in these dogs. Okay. If you look at the blue lines, that is the protein. The black line would be your NRC minimum value, right? Almost all of them, except maybe one, and one of them is at the requirement, but all of them are above. So that's why I usually use the term protein moderation rather than restriction, although it is a restriction compared to what they normally eat. So typical diets for a dog are between 20 to 30 protein calories. Some are higher, depending on the brand and the processing, but a lot of them are within those ranges. So that 10%, that minimum, that's about 8% of the calories is pretty low, right? The red line would be your industry standards for a healthy dog, and most of them are below that. You see that there's a couple or three that are above that. Those would be your early stage kidney diets. So again, you want to use them maybe for stage 1 non-proteinuric patients. You can use a higher protein kidney diet. When you're in stage 3, stage 4, or you have a proteinuric patient, maybe you want to go on the lower end of that range. But I just want to show you that you are moderating the protein. You're not necessarily restricting it below requirements. Similar to cats, you would need to be concerned with those dogs that, in order to maintain their weight, need to eat much below label recommendations. In those, you can run into marginal protein intake issues, okay? But if you have a dog that's eating close to the average requirement and it's eating enough to maintain a stable weight, this diet should be providing enough protein to help maintain their weight, their muscle mass, etc. But then you have a variety. If you see that a kidney dog that you put on this diet is losing muscle mass, you can try to switch into a different kidney diet that has more protein. So you'll still be getting the benefit of a restriction, etc., but increasing the protein. Hopefully I'm making sense. And this can be sometimes difficult to explain. Okay. All right. So next would be your sodium moderation. This is very similar to cats. We don't really know how important it is to moderate sodium in order to manage kidney disease, particularly hypertension, either systemic or glomerular. And we tend to use it as an inheritance from human medicine, where it's something that's commonly recommended, but we don't really know how important it is. So I'm not particularly worried about sodium overall. Most kidney diets are pretty moderate. I'll show you the values. And when I recommend treats, I tend to at least avoid very high sodium treats like deli meats or cheeses. But I'm not super worried about sodium myself. Potassium is another important electrolyte. Usually kidney diets tend to be higher than average to compensate for losses through the polyuria or the acidosis. But we do have a subset of dogs that can be hyperkalemic, and sometimes that might be related to the use of some medications like ACE inhibitors, like an alprobenzapine, etc. But there's a lot of variation, so you can customize your choice depending. So I'll just show you here. Here in blue, you have the sodium content in grams per 1,000 calories of kidney diets for dogs. And you can see it ranges from 0.4 to almost 2, right? But most of them are at or below the 1 gram per 1,000 calories mark. So minimum requirement is about 0.2. So all of them are plenty above minimum requirement. You're not really restricting, but your average canine diet is about 1. So most of them are just a little bit below your typical diet. This, an orange, would be your potassium. You could see the range is higher, and this would be your minimum, which is about 1 gram per 1,000 calories, all of them above. Some of them not as higher as others. So again, if you have a patient with hyperkalemia, you can sort of decide which of the options available to you would be better suited. And you can also consider a homemade diet for hyperkalemia. Sometimes we have persistent hyperkalemia or high blood potassium in dogs with CKD, especially with specific medications like ACE inhibitors. And then even if we give them the lowest potassium kidney diet that we have available, that still persists. So we could formulate a homemade diet that's even lower in potassium if needed. And we do have a paper showing that it can be effective in controlling blood levels of this electrolyte. Next one would be your omega-3 fatty acids, EPA and DHA, particularly, which we are often recommended in inflammatory conditions. And we do think that kidney disease is associated with inflammation. And that's why it's usually recommended. And you can see in this table from this review, again, already 2 decades old, but we do have recommendations on the dosage of EPA and DHA for kidney disease, which is about 140 milligrams of both of these fatty acids per milligram of per kilo of metabolic body weight, which is kilo elevated to 0.75. We do like EPA, DHA. These usually come from sea sources or marine sources like krill oil, algae oil, or fish oil, or actual fish. Shorter omega-3 fatty acids, which like alpha-linolenic, is rich in vegetable sources like flaxseed. So you could potentially give alpha-linolenic and then the body would convert it to EPA and DHA. However, this conversion is very low. In dogs, is estimated to be about 10%. In cats, is 0, basically. So we do like to include EPA and DHA. We do have some studies in dogs with experimental kidney disease, comparing diet enriched in fish oil, comparing to tallow, which is a saturated fat, or sunflower oil, which is an omega-6 rich oil. And fish oil enriched diets did perform better in progression of the disease, in histological lesions of the kidney. It also was helpful in decreasing glomerular hypertension in proteinuria. So I particularly like them when I have a protein-losing nephropathy. I always like them. I am very pro omega-3 fatty acids, but I'm more concerned about meeting that dosage when I have a proteinuric patient. And as I said, I always try to meet the EPA DHA dosage rather than giving alpha-linolenic and rely on conversion. The problem is when you're giving a diet, you won't always have EPA and DHA or any fatty acid information on the label or on the website. So you might have to contact the manufacturer and ask them. a lot of the veterinary diets for kidney disease. You can find information on their product guides, and I will encourage you to ask your reps for those guides because they usually do have this information and on a calorie basis as well. Other things, kidney diets tend to alkalinize because kidney patients tend to be in a state of metabolic acidosis, especially advanced stages. Metabolic acidosis has a lot of problems. One of them is it can promote muscle mass and cachexia. So we want to treat it if we can. Kidney diets promote alkalinization by altering the mineral balance. So if you have your anions or your negatively charged ions compared to your cations. Usually negatively charged ions acidify, positively charged ions alkalinize. So moderating the protein helps with that. Not because of the protein, this is not a nitrogen issue, but a lot of protein has also sulfur, which is an ion, right? A lot of kidney diets will use supplements like potassium citrate also to alkalinize, no? Potassium being a positive ion that can help alkalinize as well. B vitamin supplementation is very common in kidney diets as their losses are higher through the polyuria, and they tend to also be enriched in antioxidants as we do consider kidney disease to be a pro-oxidant situation where generation of antioxidants might overwhelm the body's antioxidant system and contribute to clinical signs progression of the disease. I don't usually recommend supplementing antioxidants on top since these diets are already enriched, and oxidation and antioxidation can be very tricky. One substance can be either or one or the other, depending on amounts and a lot of complex things. So I don't think supplementation of antioxidants really helps. Fiber is one of the other things that we will see, and I'm going to spend some time talking about fiber, especially given its role on gastrointestinal health. But the main reason that kidney diet started adding fiber, and this was patented by a pet food company as a nitrogen trap, they call this the process of enteral dialysis. So basically, this would be your gut. The red box on the bottom would be your blood vessels. Those would be your enterocytes, and then on the top you would have your mucus, your bacteria, etc. Right? So bacteria in the gut, in order to grow and multiply, need two things. They need energy and they need nitrogen. So energy for bacteria comes from fiber. When the bacteria ferment the fiber, you get your short chain fatty acids or volatile fatty acids, and those are source of energy, and that can make them grow. They are also source of energy for the enterocytes, so they have a trophic effect on the gut. And then where are they getting their nitrogen from? They can get it from the bloodstream. They can get that urea from the blood into the gut to help that bacteria grow. So the idea is that when I'm giving this fermentable fiber, the urea gets shunted to be excreted through the gut rather than being excreted directly through the kidney, right? How clinically relevant this is kind of unknown, but potentially helpful to decrease nitrogen waste products, and those bacteria would be then excreted through the feces, right? However, the fiber has been recently more looked into as it can also have a role in the management of gut uremic toxin generation, right? And just a few words about fiber. Fiber is very heterogeneous nutrient, right? Especially if you compare it to something like protein or fat, like, you know, there's differences and stuff, but tends to be pretty well-defined kind of nutrients. However, for fiber, they're all over the place. There's a lot of different fibers. They can have very different properties depending which one you use. So we tend to separate them into soluble or insoluble, given their capacity to disperse in water, right? So for example, in this picture, you see that's like a breakfast cereal that's fiber enriched. When you add water, there's really no change. That's basically paper. And this tends to come in and into the mouth and out of the feces unchanged, okay? Soluble fiber will be the other picture you can see here. It will disperse in water. In this case, this is psyllium husk. It gives a viscous kind of product. There are other fibers like fructooligosaccharides or inulin that you would mix in water and you would not know there's anything in there. They're completely transparent, completely soluble in water. And there's definitely ranges, okay? And then on the other hand, we can also classify them as slowly or rapidly fermentable. So that relates not to their physical properties, but relates to how they can be utilized by the bacteria in the gut. Right. So again, when you give something like cellulose, which is very slowly fermentable, it's not going to be very much used by the bacteria. But when you give something like fructooligosaccharides, metaglucans, etc., those will be used by the bacteria easily. Okay. Solubility and fermentability can go hand in hand, but not always. A lot of fiber that is soluble is also highly fermentable, but not always. We have fibers that are moderately soluble but are lowly fermentable, things like that. But overall, soluble and fermentable tend to go hand in hand. So you can see there's a lot of fiber sources in pet food that will be providing one the other or a mixture, like beet pulp will provide a really nice mixture. If you give something like pectin that comes from, or apple skin, that's mostly soluble. So you can have a lot of different combinations depending on the actual ingredient that you use. Fiber can help in a couple of ways. Like in addition of doing this enteric dialysis or moving nitrogen waste products from the blood into the gut to be excreted, it can also help with constipation, right? If I have a patient that's constipated and there's more time for the gut-derived toxins to form, if I help with the constipation, I help things move along, I will be decreasing the time that these substances are in the gut available to be fermented, so that's positive. A lot of different types of fiber can help with constipation. You can give insoluble fiber like cellulose that will help with accelerate transit time and facilitate peristalsis, but soluble viscous fiber can also help lubricate the feces and help them excrete, etc. The other area in which fiber can help in CKD is to modify the fermentation substrate. So I stole this image from a human website. They're not really talking about kidney disease, but basically the idea would be if I have these uremic toxins that are generated mostly through protein fermentation, and I'm getting, you know, the TMAO, the pre-cresol sulfate, all of the branch chain fatty acids, all of those substances that come from protein fermentation that can have negative effects. Then if I provide them an alternative source of fermentation, like giving them fermentable fiber, then we can shunt that. Short chain fatty acids that are obtained through fermentation of fiber compared to the ones obtained by fermentation of protein will decrease the pH, and that will decrease the survival of some pathogenic bacteria. The short chain fatty acids that are generated from fiber are also very trophic for the gut. So for example, butyrate is the fuel of choice of colonocytes. And if I give them the fiber, the bacteria are going to ferment that and they're going to give butyrate to the gut, strengthening that barrier function. And that's what we would hope. Okay. So you would be selecting for the bacteria that you want when you give them the fiber. So that would be the goal of adding some fiber in your kidney diets, right? However, we're still a long way to go. What's best fiber type and amounts? Most kidney diets that I know add some fiber, but a pretty moderate amount. And this is good because if I give a very high fiber amount, in these cases, first, your energy density is going to suffer. And a lot of your kidney patients, especially advanced cases, are going to be thin. Okay, so you don't want to drop the calorie density by a lot. And the other thing that you're going to achieve if you give a lot of fiber will be a reduced digestibility. And we already discussed that we don't want that. However, having small amounts of prebiotic or fermentable fiber can be very positive, even if you don't have kidney disease, right? We do include that in a lot of healthy pet diets. The other problem with fiber sometimes is we cannot really compare different diets. At least in Europe, legislation is that you have to report crude fiber which is a terrible indicator of actual fiber content. So I would recommend you ask companies if they can share total dietary fiber information with you. That can help more. But I do like to check that my kidney diets have some ingredients like fructooligosaccharides, chicory root, inulin, you know, all of those ingredients that will be providing fermentable fiber to the gut. So what are our potential therapeutic targets here? Just to summarize a little bit what we talked about. When we're dealing with the protein malassimilation, moderating the protein and increasing the digestibility of the protein could help increase assimilation of that protein and decrease the amount of substrate in the colon. So we could potentially decrease not only the synthesis of gut-derived uremic toxins, but also these other undesirable metabolites. If we provide some prebiotic fiber, we could potentially help with this dysbiosis and try to shunt from more of proteolytic kind of fermentation to more of a carbohydrate kind of fermentation or saccharolytic. It has been proposed that we could be probiotics for this reason as well. However, we don't really have a lot of evidence. And I'm a nutritionist, I like nutrients, so I will always cheer for fiber. But I think just giving one or a few bacteria in a very complex ecosystem is going to be less efficient than just giving them the food and selecting for the overall bacterial population that you like, right? For constipation, of course, fiber can be useful, at least some amounts, but you can also manage that by hydration, ensuring that they're well hydrated, managing any electrolyte disturbances, and if needed, you can use laxatives. And again, prebiotic fiber can also help with barrier function. As I said, when we give the food to the bacteria that they need, we're going to generating this butyrate or other short-chain fatty acids that will be the food for the colonizied. They will help strengthen that barrier function. So just to finish up, just some tips on how to do your nutritional plan. I already told you anything you need to know. But make sure that every patient that you have with CKD, you choose a plan for them. And a feeding plan is answering your 3 questions. What do I feed? How much do I feed? And how do I feed it? So make sure that you do your nutritional assessment. We do have a lot of tools for you at the WSAVA Nutritional Guidelines website. I used to be a member of this committee, and since this September, I'm gone, but I still recommend, it's a great resource for everybody. So you have a paper, you have a lot of tools that will help you do your nutritional assessment. The other thing you need to consider before you make a nutritional plan is when do you start, right? Even if you're not going to give them a kidney diet, you still have to give them a feeding plan, like what to feed, right? But when do you start the kidney diet? It's the question. And I would say we have really good evidence that from stage 2 onwards, diet change is beneficial. And the more advanced the disease, the more aggressive you will have to be with your protein moderation and your phosphorus restriction, potentially needing binders. For stage 1, there's little clinical evidence for diet change. And I'm going to say yet, because I think diet change theoretically should help. It's just as we don't have the studies at this point. However, if you have a patient that's proteinuric, I think the evidence is there to change it. So if I have a stage 1 proteinuric patient, I will consider a kidney diet, depending on what they're eating right now. Also consider the less sick the dog is, the easier it is to change the diet. So if I'm going to wait until stage 3 or 4 to change diet, those dogs are usually clinical. They are sicker compared to a stage 2, stage 1 patient that they tend to be clinically well and feel well in themselves. And a diet change can be much easier to do in that circumstance. So are you going to change diet or no? Maybe. If you have stage 2 onwards, I would recommend yes. If you have a stage 1 proteinuric, I would recommend yes. If you have a stage 1 non-proteinuric, maybe. If the current diet is very high protein, high phosphorus, maybe you can find a different maintenance diet that is closer to your goals on those nutrients, for example. So make sure you do a good diet history before you decide. And then you're going to need to decide which of the available diets. So how aggressive do I need to be with my protein moderation? Is this a proteinuric patient? Is this very azotemic? I'll be more aggressive. Palatability and appetite are going to be huge in making your decision. How hyperphosphatemic is the patient? Do I have hyperkalemia issues? Do I have any comorbidities, right? I would say one of the main reasons I get asked to do homemade diets for dogs is a combination of chronic kidney disease and a fat sensitive condition, right? Like pancreatitis or things like that. And we sometimes think that pancreatitis might be more common in kidney patients. I don't know if it's true. It's just probably my bias, because there are no low-fat kidney diets, honestly. I mean, you can choose of all your diets that for kidney, choose the lower fat one to see if it works. Otherwise, maybe a homemade diet could help. For allergies, could also be. I was very happy to hear that Specific is launching hydrolyzed protein kidney diets, because that it's a really good combination for when you have this type of diseases, in addition to potentially being very highly digestible. So you have a lot of commercial diets to choose from. Look at your dry and your wet differently, because they are different. Even though they share the same name, they can have different things that you might be more interested in. Homemade diets are a definite possibility. As I mentioned, sometimes for some comorbidities, or if you're, as I said, if your potassium in blood is too high and you cannot control it with a commercial diet, we can also help with a homemade diet. A lot of the times I also get asked to do them in patients that only have kidney disease, so don't have other comorbidities, but they're don't particularly enjoy the commercial options. Like, I always try to give them ideas to make the commercial option more palatable, because cooking is a nightmare sometimes and expensive. But my latest patient is super happy eating her homemade kidney diet, and that also has a lot of value. But they are time consuming and expensive. There are issues with commercial recipes that you find online or in books, including those for kidney disease. So I don't recommend them. And I would recommend that you consult with one of us to help you out for a fully customized recipe. You can also, of course, give treats. They can help entice your patient to eat. Just make sure that your treats are not sabotaging your plan. So don't use chicken or turkey or things that are very high protein and high phosphorus potentially, or high salt treats. If you give a lot of treats, you can unbalance the diet and lose the therapeutic effect. So everybody's losing here. We're wasting money and we're not getting what we want out of our dietary treatment. So what I usually do, if they want to give treats, just make sure they're kept within that 10% of your daily calorie intake. And that not only includes commercial treats, but also any unbalanced items, table foods, supplements, dental treats, anything that's not your complete diet. For dogs, I often use fruits and veggies. They're great. This is the kilocalories per 100 grams, but you can find this information on nutritional databases in your countries. But I often use banana, apples, and broccoli and carrots. Some people really like, some dogs really like bread or plain cereal like cornflakes. Those are pretty calorie dense, but they're very high carbohydrate, which I like as a treat. So low protein and low phosphorus. Honey, melon, watermelon are also great. Be careful if you have a hyperkalemic or high potassium patient, and try to avoid things like banana, potatoes, sweet potatoes, because those are very high potassium. And some brands do have commercial treats specifically for CKD. Those are also really nice if you want to give them. Supplementation, you can consider something like fish oil or krill oil or algae oil in protein-losing nephropathy at this dosage. Think that if you're using an oil, it provides about 40 kilocalories per teaspoon, and that has to be within that 10%, including other treats. So this will limit a lot how much oil you can add. So if you're going to add it, make sure that the oil has at least 20 to 30% or more EPA DHA. Some of the oils that you can find online and on stores are as low as 6 to 10% EPA DHA, and that's really not very useful to you. Make sure that it's not contaminated with dioxins, PCBs, Some of them have a lot of vitamin D and A, which can be dangerous. So I always ask the manufacturer to tell me what do they do to prevent this. And I personally prefer to get a diet that already includes them in good amounts, so I don't have to worry to add extra. But that just makes it easy for me, and there's less concerns. I have to do less work, and I have to be less worried about the supplement being safe. I don't necessarily, as I said, I don't really rely on probiotics, but sometimes I will supplement fiber, especially if I have a dog that has some constipation. I will add some psyllium husk into their lives, and it can work really well. Maybe starting with teaspoon per day, divided over meals, and see how that works. I don't know that we know yet if adding other types of fiber can be helpful, but I do like to check diets that already include some. Supplementation with amino acids, in a way, no, especially in those dogs that are losing muscle mass. I don't know that we know how helpful this is, right? We have that one paper that showed that it can help increase serum albumin and body weight, but it can also worsen or not improve your proteinuria. So for me, the jury is still out, so I'm not recommending them on a routine basis. I just make a lot of effort to check how many calories this dog is eating, and then check each diet if they're meeting their protein needs at least. In any case, if you decide to supplement, ask the manufacturer about data on efficacy and safety, as their regulation is a bit more lax compared to medications. Once you have decided on your diet, plus minus treats, plus minus supplements, you need to decide on the amount to feed. You can use formulas. Calorie requirements in dogs vary from 95 to 130 times body weight to the 0.75, that's a typo. Or you can use label instructions, but if you use a formula or the label, there's a lot of error. So I usually try to figure out what the dog is eating right now and then go from there, but it's not always possible. You just need to adjust every couple of weeks, get a new weight and body condition score on the dog, and go up and down. If you're going to give unbalanced items, then you can say, okay, 90% for the main diet, 10% for other items. Make sure you switch to a kidney diet, not in the hospital, not when they're sick. They need to be feeling really nice and well and comfy at their home, and go as slow as you need to go. Some of my patients are free-fed because they tend to be thin and with a picky appetite. It's really nice that they always have food available. But if they're obese prone, then I will portion control them. That will all depend on each case that you have. Similar to cats, if you were on my previous webinar, there's a lot of reason why a dog might have a risk of malnutrition with CKD, mostly related to a decreased appetite associated with nausea, anemia, hypokalemia, hypertension. Humans in dialysis describe an altered sense of taste, and this can also be happening in our dogs. And, you know, in addition to decreased appetite, dogs can also be having an increased energy expenditure, or, you know, this protein malassimilation, and this inflammation can also increase the risk of malnutrition. So we really want to make a lot of effort to get the dog to eat the right diet in the right amounts. If they eat the right diet but not enough, they're going to be losing weight, losing muscle mass. That's bad. If they eat enough but the diet is not the right one, their uremia is going to increase. They're going to be feeling worse and might live shorter lives. So of course, if I have to choose, I rather they eat whatever, but I make a lot of effort to get them to eat the right diet in the right amount. So make sure you work up why they're not eating. A lot of these things can be solved, can be treated. You can play around with diet changes, rotation, modifications, and you can also use a feeding tube to get them over the worst of it. Feeding tubes can provide nutrition short and long term. For most of my kidney patients, I've used them in the short term to get them over a particularly bad episode or an acute on chronic situation, but I have also had some end-stage disease patients on feeding tubes for a bit. You can medicate and hydrate them through the tube, and I tend to talk to them, the clients, early in the disease, so they're not super stressed when they have to decide if they want to put them or not. Don't forget your water. Besides the feeding tubes, you can also use subcutaneous fluids. You can flavor water with broth I sometimes have them do homemade chicken broth at home without salt or onion, and then freeze it on an ice cube tray. And then they can use those ice cubes to put on the water to flavor it, for example. If you're using a wet food to keep them hydrated, that's perfectly fine. That works really well to hydrate them, but their energy density is going to suffer. So they need to eat more volume. So if they have a poor appetite, be very careful. And they're also very expensive. Okay, and finally, you do your follow-up using your nutritional assessment and your clinical signs. I would say, besides the typical things like weight, muscle mass, hydration, make sure to check your stool quality. If I see patients that have a poorer stool quality, I will worry that maybe the digestibility of the diet for this individual is not enough, and maybe I will try to switch to something more highly digestible if I can. And of course, your laboratory values can also help you out decide if your diet choice is correct or you need to adjust. So some takeaway messages. Specially formulated diets can improve survival and quality of life in dogs with CKD, which is beautiful for me. We don't have a lot of, for some other diseases, I wish we had this good evidence that we have for CKD, obviously. Make sure you stage your dogs for CKD to choose a more customized and targeted dietary management, right? Especially to decide when you're going to start, which is stage 2 onwards, and some in stage 2, especially if they're proteinuric. You have a lot of commercial options with different nutritional profiles, and that will allow customization of your diet choice according to the clinical presentation, the lab work, preferences, etc. So make sure you are familiar with the CKD diets that you have. And, you know, a lot of focus on getting them to eat it. So I want them to eat the right diet in the right amounts. So make sure you work up any inappetence. Make sure you do your transition very slowly when they're feeling well and early in the disease. That's going to help out. And feeding tubes can help you out in some cases. I'm not sure I don't really recommend amino acid supplementation when they're losing muscle mass and weight at this point, maybe in the future when we have more data. The kidney disease can affect gastrointestinal function, which in turn can contribute to CKD progression and clinical signs. So this is kind of a vicious circle via generation of gut uremic toxins and other mechanisms as we have seen. So the good news is there's a lot of active research on the gut-kidney axis to identify therapeutic strategies. But diet-wise, the minimum you can do is give them a CKD diet that's highly digestible and has a really good quality protein. That has at least some amount of prebiotic fiber. I think the role of supplementation with probiotics is still unknown, so I don't routinely will use them. As I said, I will use some fiber for constipation if I have to, but probiotics, not yet. And with that, thank you. I hope I didn't chat too much over the time. And if you have any questions, I'm happy to answer.
Thank you, Cecilia. And I think it's always interesting to listen to you because you're so engaged and so you know so much about these things.
I try. I like this is a frustrating disease, but there's a lot of good that we can do with diet, which makes me happy.
Yeah, and that's it's also interesting that we actually can do a lot and do for the pet and also for the survival time. We have a few questions here.
Okay.
The first one is, in the cat lecture, you discussed the development of hypercalcemia with phosphate restriction. Is this seen in dogs as well?
We have not seen it. I have not seen it personally, and I haven't found any publications either. And I've been chatting with my colleagues. Some of them said they have seen it. And then it seemed to help when they switched to a diet that maybe was not as phosphorus restricted, but it doesn't seem to be the same issue in dogs compared to cats, at least for now.
Yeah. And then the next one is about is it common that renal diets are not so appetizing to dogs like it is to cats, or is it easier to get the dogs to eat them?
I think it's easier just because dogs are dogs and like they're not as selective. Like they're more they're more of a kind of situation. They're not as maybe selective, but definitely it is an issue. And I'm not gonna lie. Like as I said, like a lot of the times that I get asked to do a kidney diet is because it's a dog that's not eating it, but oftentimes it's because the disease has progressed. And then it doesn't matter if it's a dog or a cat sometimes. And then for dogs, fat can work better than in cats, like fat alone compared to in cats where the protein is more of a drive of palatability. So I have less issues in dogs than in cats, but the issues still exist.
Yeah. But also in regards to that, do you think is it any difference in dogs and cats in which stages they actually are coming to the vets, or is it
definitely possible? Yeah, we know that cat owners might be more reluctant to bring their cat to the vet, as it might be a more stressful situation, or in some areas of the world they're a bit of a second-class citizen. I mean, I do take my cats to the yearly checkup, but I sometimes think, do I really want to stress them out? So that can definitely play a role. So I can only speak to what I know. But it seems cats are trickier in general.
They are very good in hiding how they feel.
But that said, at least we have, like mirtazapine works relatively well in cats, and so we have more tools managing inappetence in cats than in dogs, at least medical. And there is a capromorelin analog, but as far as I know, it's not available in Europe for dogs. But we do have it for cats. So when the dog is inappetent, I have tried mirtazapine in dogs too, and in some dogs seems to help.
Sometimes it's
but it seems to be more of an effort to figure that out for cats because they're a pain.
And then the next question is, could you repeat how much psyllium do you add for CKD pets?
Yeah, it depends a little bit, but depends on the size of the dog. But I will usually start maybe with 1 teaspoon, which is about 5 grams of psyllium, divided at least over 2 meals. And then you can go up, see if that would help. If you give too much psyllium, like I had one case, it was not a kidney case, but it was a dog that was on a hydrolyzed diet, doing really well otherwise, but became constipated. So I really didn't want to take him out of the hydrolyzed diet. So I added some psyllium, and I told them, just give half a teaspoon per meal. And I was very dumb. Like I didn't ask them how many meals per day they were giving. I thought it was 2. They were feeding him like 6 times a day. So
oh my God.
They called me 3 days later, like, what is going on? I think my dog has parasites, just because the psyllium had made like a gel cake. Like it looks like a chain link. It looks like an alien. Like it's really weird. So you need to go very slow. So I would say starting with a teaspoon per day divided at least over 2 meals is a good start. And then if you give too much, if you don't tolerate it, they will start seeing like softer stool or this weird gel. So you increase it to effect or to side effect, and then it's not working maybe. But that's what I would do. I would start with about a teaspoon per day. Make sure it's unflavored and unsweetened.
Thank you. And then we have the next one. How do you manage high cholesterol and kidney disease, for example, in dogs with Cushing's disease? That was an easy one.
I don't know that I manage. Like the high cholesterol in dogs, it's more of a sign that something needs to be addressed than a problem in itself, at least in my mind. Like in people is different, right? We know that high cholesterol in people can promote the appearance of coronary disease, atherosclerosis, etc. This is not something that worries us in dogs. Like I think I've only seen one dog that had atherosclerosis, and it had like a really weird disease where the cholesterol was bananas high. Sometimes we do see the corneal deposits, and if that's happening, then I might address, but I might address cholesterol with medication rather than with diet. I forgot the name of it, but some of my colleagues do have, like I think it's gephibrosate, things like that. And also I have sometimes tried to manage cholesterol like with a lower fat diet. Like the vet has said, let's try a kidney diet that's also lower in fat to see if we can manage that cholesterol. And I have not always been successful. So they don't always respond to a low fat approach. And also it's really hard to get the dog to eat such a diet, like a low fat, low protein, relatively low protein and fat diets. There's basically rice with a little bit of chicken on top, right? And that's tricky. So I tend to either benignly ignore and control if I'm getting sequela of this high cholesterol, or go to or talk to my medicine friends and ask them about medication. Yeah. That's a great question.
And then we have the last one. Is there any benefit long term of starting a kidney diet in an older dog that is a CKD stage 1? And the other way around, if we have a dog that doesn't eat at all kidney diet, how quick can the prognosis worsen?
Okay, those are really tricky. So for the first situation, we don't have the evidence, doesn't mean it's not helpful. Like I would say, when you have a stage 1 patient, you usually find those accidentally. Like I do an ultrasound for a reason and then you see some changes, or it's a proteinuria dog where I would definitely put him on a kidney diet. But if it's not proteinuric, it's not azotemic, it's a stage 1, it's hard to justify to put them on a kidney diet because I don't have the evidence and those are expensive, but it doesn't mean it wouldn't be helpful. So what I usually try to do is I figure out what they're eating right now. So sometimes I have some of those patients that are eating maybe a raw diet that's very high in protein and phosphorus. Maybe I'll switch them to a normal maintenance diet and I will be dropping the protein by 40% and the phosphorus by 68%, and I'm still not on the kidney diet levels. So I might do that. And if they're eating more of a normal food, I sometimes look at some of the senior diets out there. And there's no official definition of what a senior diet is, so you have to check. But I will check that protein, I will check that phosphorus. Some of the intestinal diets can actually be pretty moderate in both of those, depends. So I will sometimes change the diet, but depending on what they're eating right now, but won't necessarily put them on a kidney diet if they're stage 1 without proteinuria. That said, if the client is worried and we decide maybe we can give it a try, there's really no, I'll put them on an early stage kidney diet, maybe not to be super aggressive, and see, like it's pretty okay in that regard, but not my first choice. Second question, like if we know how fast it will progress, like I don't know that I know the answer, but in those studies that they gave dogs a normal diet and a kidney diet, like the difference in survival was a year or more. So, and some of the cases that I've seen personally have been pretty short-lived, but usually again, they tend to be stage 3, stage 4. I think one of them was a dog that was eating a kidney diet. It was eating a raw diet. Dog loved that diet. We tried to do homemade, try to give similar ingredients, pretty high fat, but the dog would refuse. So they put him back on his diet, and I think it was 2 months. But he was already stage 3 when I saw him. So it's hard to tell because it will depend on the staging and the actual cause of the kidney disease. It might be different if it's a, interstitial nephritis or something like, glomerular nephritis secondary to leishmania. Like, I don't know. What you can know is that it's going to be a shorter life. But when you have to put your priorities in place, then eating is a priority. So in some situations,
of course, that's basic. They actually need to eat. If they refuse everything else, then the bad diet, then what to do?
I mean, we can do tricks. We can try to make it. Again, a reason that I do homemade diets often, and sometimes that works. Sometimes that works. Sometimes it doesn't. So we give it a try, and if not, then we manage the kidney disease how we can. You use your phosphate binders, you keep them hydrated, but it's a bad choice. That's the only choice you have.
Yeah.
That's a question.
Yeah. that was the last question.
Oh, excellent. Thank you, guys.
And a big thank you to you that we have been able to use you twice on this topic.
Hope you're not sick of me with this time.
Yes. There will be a chance that we ask you again because
I'm
you're
always
really
happy.
nice. You're really
Yeah.
nice and interesting to listen to. So
Thank
thank
you.
you a lot for that. And thanks to everyone that has listened. And the lecture has been recorded and we will upload it on DECRA Academy. And I guess that most countries also will send out the link to all registered on this webinar when it is uploaded as well. So we will try to spread it to you if you want to watch again or give it to a colleague or something like that. So thank you for tonight.
Thank you, guys. My
Yes.
pleasure.
Bye-bye.